Before we get started, comment your name and your state below. I'd love to see who's watching and benefiting from these videos. Every time I scroll through the comments and see people from Florida, Texas, California, New York, Tennessee, and everywhere in between, it reminds me why these videos matter. Medicare is complicated, and sometimes it feels like the system is almost designed to confuse you. So knowing who I'm talking to helps me make these videos clearer, more useful, and more real. Now let's get into something that has quietly become one of the biggest conversations in all of Medicare. I'm talking about the gap between what people think they're signing up for when they choose a Medicare Advantage plan, and what they actually experience once they start needing care. And this isn't just seniors saying it. Hospitals, doctors, and entire healthcare systems across the country are now raising the same concerns, almost word for word. It's like two different sides of the same story finally coming together, and both sides are saying, this isn't working the way it's being sold. Let me start with what I keep hearing from people just like you. Maybe you've experienced this yourself or know someone who has. A person turns 65, they start getting call after call after call. Postcards in the mailbox. TV ads. Flyers that look like government letters but aren't. Some of the ads sound official. Some feel urgent. Some make it seem like if you don't call right now, you might lose out on something. And almost all of them highlight the extra benefits: dental, vision, hearing, gym memberships, over-the-counter cards, transportation, meals after a hospital stay, and everything else. But here's the part they usually don't highlight: how those benefits actually work, when they're approved, what the limitations are, and what the plan can deny, even if your doctor believes it's necessary. I once spoke with a woman named Linda from Arizona. She said she chose her plan because the agent told her it included full dental. That was the word she remembered: full. She imagined cleanings, crowns, implants, the full package. But after she enrolled, her dentist told her only the cleaning was covered. The crown was not medically necessary. Later she found out the implant wasn't covered at all. And the worst part? She said she never knew she needed prior authorization for something as simple as a crown. Nobody mentioned that detail when she signed up. Now, to be fair, not all marketing is misleading. There are good agents, ethical agents, and honest plans out there. But the style and volume of Medicare Advantage marketing, especially during that fast, stressful October to December enrollment window, creates a real risk of misunderstanding. People are trying to make the right decision under pressure, and they're making that decision based on ads designed to get attention, not to explain the rules. Here's where things get even more interesting. Hospitals across the country are reporting almost the exact same issues, but from the opposite side of the table. Some of you know I stay very plugged into hospital reports because they usually reveal what's happening behind the scenes long before the public hears about it. And what hospitals are saying right now is astonishingly consistent. They're seeing rising rates of denials for care that doctors believe is medically necessary. They're seeing delays for routine approvals, things that, on original Medicare, wouldn't require any approval at all. They're seeing entire teams of staff spending hours appealing decisions just to get a senior the treatment they need. One hospital administrator said something that stuck with me. He said, the patient thinks their plan is saying no. But really, the plan is saying, not yet, not unless you prove you need it, and not unless every hoop is jumped through in the right order. And that hits hard, because that is exactly what many beneficiaries experience. This is why the gap matters. On one side, beneficiaries are told about extra benefits, convenience, and simple coverage. On the other side, hospitals are struggling to get approvals, fighting prior authorization rules, and watching seniors be delayed or denied care. These two experiences are not separate problems. They're the front end and the back end of the exact same system. Let me give you another real story. A man from Ohio told me he chose his Medicare Advantage plan because the commercial said it included comprehensive dental benefits. He was excited because he needed major dental work done. But when he went to schedule it, he found out he needed prior approval. And guess what? It got denied, twice. And the irony? This happened right at the same time that hospitals across multiple states were reporting the exact same issue, prior authorization expanding far beyond what they saw even a few years ago. Now, I want to pause here to mention something important for 2026, because this will matter for a lot of you. Medicare Advantage plans are expanding their dental offerings in 2026, especially in competitive counties. More plans are adding broader dental allowances, deeper coverage on major dental work, and in some areas, higher maximums. This is good news. But, and this is the part one need everyone to hear, it does not change the fact that dental in Medicare Advantage is not standardized. Every plan decides its own rules. Every plan decides its own limits. And every plan decides whether something requires prior authorization. So yes, 2026 will bring better dental coverage for many people. But the experience will still depend on the details of the plan, the network, the approval rules, the coverage criteria, and the internal decision process that most marketing does not mention. Let me take you back to something else I see over and over. A lot of the confusion around Medicare Advantage is not because people are choosing the wrong plan. It's because they didn't have enough accurate information to choose the right one for them. And that's an important distinction. Most problems in Medicare Advantage happen in the space between expectation and reality. That's exactly where people get hurt, not physically necessarily, but financially, emotionally, and in their trust in the system. Think about it. You see a commercial promising a grocery card. You see someone smiling because their plan offers dental. You hear the words, "zero premium." But you don't hear that the grocery card only works for certain foods. You don't hear that the dental benefit may require prior approval. You don't hear that zero premium doesn't mean zero cost, deductibles, copays, and out-of-pocket maximums still apply. And you definitely don't hear that your primary care doctor might leave the network mid-year. One man from Michigan found this out the hard way. His cardiologist left his plan's network in April, 4 months after he enrolled. He told me he had no idea a doctor could leave after he joined. He thought his yearly enrollment kept everything locked in. But that's not how it works. Networks can change anytime. Doctors can leave anytime. And your only option is to either pay out of network or wait until the next enrollment period, unless you qualify for a special enrollment period. And for those of you watching this as the calendar rolls into the new year, here's a reminder, from January 1st to March 31st, there's a do-over period. If you joined a Medicare Advantage plan and immediately realized it's not what you thought, you can switch to a different Medicare Advantage plan or go back to original Medicare. Not everyone knows this. Not everyone uses it. But it's one of the most important protections seniors have. Now let's circle back to what hospitals are saying, because this part of the story is huge. Hospitals are reporting that Medicare Advantage payments are less predictable than original Medicare. They're saying administrative pressures are increasing every year. Doctors are telling patients, "I recommended this treatment, but your plan denied it." And seniors are left asking, "But they said everything was covered." It creates a domino effect. The marketing creates the expectation. The plan's internal rules shape the reality. And the hospitals are stuck in the middle, trying to bridge the two. So what does all of this actually mean for you, especially heading into 2026? It means that making a Medicare decision based on marketing alone is not enough. Marketing is designed to capture attention, not to explain how approvals work, how networks are structured, or how your specific health needs will be handled. And it means the real experience inside a Medicare Advantage plan is determined by details most people never hear about during enrollment. Your plan's network. Your prior authorization rules. Your referrals. Your coverage criteria. Your dental rules. Your 2026 updates. Your medications. Your doctors. Your hospitals. Your county. These are the factors that shape your experience. And none of those factors are mentioned in the 30-second TV ad with the smiling senior sitting in a park. But here's the good news. When seniors understand these differences, when they slow down, read their summary of benefits, ask the right questions, and get real guidance, they make better decisions. They avoid the traps. They avoid the denials. They avoid the surprises. And they choose plans that match their real needs, not just the promises they saw on TV. If you take anything away from this video, let it be this: the more informed you are about how Medicare Advantage actually works, the better protected you are. Awareness is one of the strongest tools a senior can have. And that's why, in my honest opinion, you should work with someone who understands the system inside and out, someone independent, trained, certified, and who looks at multiple plans, not just one. Because Medicare is not one size fits all. It's personal. It's individual. And the right plan for your neighbor may not be the right plan for you. If you ever need help, we'd be glad to help you. Just reach out. Take care of yourself, stay informed, and thank you, truly, for watching.